Walk down a supplement aisle or a yogurt case in an American grocery store, and you'll see the same handful of phrases over and over. Supports immune health, boosts your metabolism, helps maintain healthy joints, packed with antioxidants. These phrases are so common, they barely register anymore. They're just what the front of a health food package looks like. Now take that exact same product, or one very close to it, and put it on a shelf in Germany, France, or Norway. In most cases, none of those phrases would be allowed to appear on the packaging at all. Not because the ingredients are different, not because the product itself is banned, because in the European Union, you are not legally permitted to print a health claim on a food product unless a specific European food safety body has formally reviewed the scientific evidence behind that exact claim and approved it word for word in advance. This is a completely different regulatory idea than anything we've covered on this channel so far. The last few videos have been about ingredients, additives, hormones, preservatives, things a country decides to allow or restrict in the product itself. This video is about something else, the words allowed to appear on the outside of the box. And once you understand how differently the US and the EU treat that question, you'll never read a supports immune health label the same way again. Let's start with how the American system actually works, because most people assume claims like these have been checked and approved by the FDA before they hit shelves. They haven't. In the United States, claims like these fall into a category called structure and function claims, a term that comes out of a piece of legislation called the Dietary Supplement Health and Education Act, usually just called DSHEA, passed in 1994. Under DSHEA, a company is allowed to state that a product affects the structure or function of the body, supports immune health, helps maintain healthy joints, promotes relaxation, without needing pre-market approval from the FDA for that specific claim, and without needing to submit clinical trial data proving it works before printing it on the package. What the law does require is narrower than most people assume. The company has to have some form of substantiation on file internally, evidence they could produce if challenged, and the claim has to be, in the legal language, truthful and not misleading. And critically, any product making a structure and function claim is required to carry a specific disclaimer, usually in small print somewhere on the label. This statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. You've almost certainly seen that sentence 1,000 times without registering what it actually means. It means, in plain language, that the bold claim on the front of the box has not been checked by any government body before you bought it. The company is asserting it. The FDA is not confirming it. This is what is called a post-market enforcement model. The government does not review the claim before it appears on shelves. Instead, agencies, primarily the FTC, which handles advertising claims, and the FDA, which handles labeling more narrowly, can take action after the fact if a claim turns out to be false or misleading through warning letters, fines, or lawsuits. There have been real, well-documented cases of this happening. In 2008, the maker of Airborne, a supplement marketed heavily as a way to prevent colds, settled an FTC action for $23.3 million after regulators found the company's claims were not backed by the kind of scientific evidence the marketing implied. POM, wonderful. The pomegranate juice company spent years in FTC litigation over claims that its juice could reduce the risk of heart disease, prostate cancer, and erectile dysfunction, claims a federal court ultimately found were not adequately substantiated in a case that went all the way to the DC Circuit Court of Appeals. But these are examples of the system working after the claim already reached consumers, sometimes years after, not before. Now, let us look at the European approach because it inverts this entire model. The EU framework is called the Nutrition and Health Claims Regulation, formally Regulation EC 1924-2006, which came into force in 2007. Under this regulation, no health claim can legally appear on a food product anywhere in the EU unless it has been submitted to the European Food Safety Authority, EFSA, the EU counterpart to the FDA on scientific food matters, reviewed against the available clinical evidence, and formally added to an approved list called the EU Register of Nutrition and Health Claims. If a specific claim is not on that list, in that exact approved wording, it cannot be printed. Not probably cannot. Cannot. This is a pre-market approval system, the opposite of the US structure and function model, and it is a genuinely enormous undertaking. EFSA had to evaluate a submission backlog running into the tens of thousands of proposed claims when the regulation first came into effect, as essentially every food and supplement company operating in Europe had to submit whatever health language they wanted to keep using and wait for a scientific ruling. The results of that review process were, by most industry accounts, brutal. The overwhelming majority of submitted claims were rejected or withdrawn, either because the submitted evidence did not meet the European Food Safety Authority's bar for demonstrating a genuine cause and effect relationship, or because companies chose to pull claims rather than go through the full evidentiary process. Only a relatively small number of claims, specific and narrowly worded ones, made it onto the final approved list. And here's the part that matters for how you read a label. If you see a health claim on a food package in the European Union today, it's not a marketing team's phrase. It's specific, European Food Safety Authority, approved language, and the company is legally required to use that exact approved wording, not a looser paraphrase of it. The single best case study for how differently this plays out is probiotics, and it is worth walking through in detail because it became a genuinely famous regulatory episode in the food industry. In the US, the word probiotic appears on yogurt, supplements, drinks, and countless other products, almost always alongside language, implying digestive or immune benefits, supports gut health, boosts your immune system. It is an enormously popular and largely unregulated marketing category. In the EU, EFSA took the position that the word probiotic itself constitutes an implied health claim, because the term inherently suggests a health benefit to the consumer, even without any additional language attached to it, and therefore falls under the same pre-approval requirement as any other explicit health claim. Manufacturers submitted a wave of applications trying to get specific probiotic strains and their associated health benefits formally approved. EFSA rejected essentially all of them, finding that the submitted evidence did not sufficiently demonstrate a cause and effect relationship between consumption of the specific strain and the claimed benefit. The most well-known casualty of this was Danone, the French dairy company, and its flagship probiotic yogurt brands, Activia and Actimel. Danone had built years of marketing around specific digestive and immune health claims tied to the probiotic cultures in these products. When EFSA reviewed the submitted evidence for those specific strain-based claims around 2009 and 2010, it rejected them. Danone's response across the EU was to drop the word probiotic and the associated health claims from its packaging and marketing entirely in many markets, shifting instead to describing the products simply as containing live cultures, a factual, unregulated description rather than a health claim. The product itself did not change. The bacteria in the yogurt did not change. What changed was that the company could no longer legally say on the package that those bacteria did anything specific for your health because nobody had proven it to EFSA's satisfaction. Meanwhile, in the US, the exact same category of products, probiotic yogurts and supplements, continued and continues today to carry immune and digestive health claims freely, subject only to the truthful and not misleading standard, and the required disclaimer that the FDA has not evaluated the statement. Antioxidants tell a similar story. In the US, antioxidant is used almost as a generic quality signal, printed on everything from berries to chocolate to skincare adjacent snack bars, usually without any specific claim attached, just the word itself functioning as an implied health halo. In the EU, general antioxidant claims without specific EFSA-approved substantiation have been restricted in much the same way as the probiotic claims. The word alone, without backing evidence for a specific, defined health outcome, does not clear the bar. A small number of very specific claims around certain vitamins and their antioxidant function have been approved. Vitamin C's role in protecting cells from oxidative stress, for example, is one of the narrow, specifically worded claims that did make it onto the approved list. But the broad, generic, packed with antioxidant style language that is everywhere on American packaging is largely not something EU food law permits without that specific backing. Immune support claims followed the same pattern. Products explicitly marketed around boosting or supporting immune function are extremely common in the US, especially in the vitamin C and zinc supplement categories. Airborne and Emergen-C being two of the most recognizable examples. In the EU, a small number of specific immune-related claims have been approved for specific nutrients at specific dosages. Vitamin C, vitamin D, zinc, and a few others each have narrow EFSA-approved language tied to normal immune system function, but broader, more sweeping boosts your immune system language, especially when applied to entire products rather than a specific approved nutrient at an approved dose, generally does not meet the bar. It's worth being fair to both systems here because it's easy to tell this story as Europe protects consumers from false claims, America lets companies say whatever they want, and that's an oversimplification in both directions. The European Union's pre-approval system genuinely does filter out unsubstantiated marketing before it ever reaches a shelf, which is a real consumer protection benefit. You're less likely to encounter a health claim in a European grocery store that turns out, on closer inspection, to be scientifically hollow. But that same rigor has a cost. Legitimate emerging areas of nutrition science where evidence is promising but not yet as extensive as the European Food Safety Authority's bar requires, get shut out of labeling entirely, even when a reasonable scientist might say the evidence is suggestive, just not yet conclusive at the level the European Food Safety Authority demands. Some public health researchers have specifically criticized the European Union system for being so strict that it discourages companies from even attempting reformulation toward healthier products, since there's little marketing upside if you can't describe the benefit on the package. The United States system's flexibility, on the other hand, gives companies room to communicate genuinely emerging science to consumers faster, and gives smaller companies a much lower barrier to describing what their product does. Going through anything resembling the European Union's approval gauntlet would be financially out of reach for most small supplement brands. But that same flexibility is exactly what allowed the Airborne and Palm wonderful situations to happen. Years of marketing claims reaching millions of consumers before any enforcement action caught up with them, if one ever did at all. For every claim that gets challenged by the Federal Trade Commission, an unknown number of similarly unsubstantiated claims are still sitting on shelves right now simply because nobody has challenged them yet. So which system is better really depends on what you weight more heavily. The European Union's approach trades speed and flexibility for a much higher bar of proof before a claim ever reaches you. The United States approach trades that pre-market certainty for faster, cheaper access to market, with accountability arriving after the fact, if it arrives at all. Now, practically, how do you actually use this the next time you're standing in front of a shelf full of health claims? First, in the US, look for that disclaimer sentence. This statement has not been evaluated by the Food and Drug Administration. If you see it, you know for certain that whatever bold claim is printed above it is a structure and function claim, not a pre-approved medical or health claim. It does not mean the claim is false. It means nobody outside the company has checked it before you saw it. That's worth knowing before you make a purchasing decision based on a phrase like supports immune health. Second, understand the difference between a health claim and a much weaker category called a structure and function claim, because both exist in the US and companies use precise legal language on purpose. A genuine FDA-authorized health claim A small, specific category, mostly involving things like calcium and osteoporosis risk, or soluble fiber and heart disease risk, has actually gone through a formal FDA review process. Structure and function claims, the vast majority of what you see on supplement and food packaging, have not. The wording is often similar enough that most shoppers never notice they are reading two completely different regulatory categories. Third, in the EU, if you see a specific health claim on a package, anything beyond a basic nutritional fact like high in fiber, know that it's gone through formal scientific review and is legally required to use approved wording. That does not mean the underlying science is perfect or beyond debate, but it does mean a regulatory body looked at the submitted evidence and agreed the wording was justified before it reached the shelf. If a product simply does not carry any health claim at all, like Activia in most of Europe today, that's often not because the company has nothing to say. It's because they tried, and the claim they wanted to make didn't survive the review. This channel compares food and product standards across the US, UK, and EU using publicly available regulatory information, including FDA guidance documents, FTC enforcement actions, EFSA's published claim register and scientific opinions, and EU Regulation 1924-2006. Content is for informational and entertainment purposes only and isn't medical or legal advice. Regulations, approved claim lists, and product formulations change over time, so always check current labels and official regulatory sources for yourself. We are not affiliated with or endorsed by any brand, company, or organization mentioned. Next time, we're staying in the same product, different rules territory, but moving out of food entirely and into your bathroom cabinet. The thousands of ingredients banned in EU cosmetics and personal care products that are still perfectly legal in American shampoo, sunscreen, and makeup. The gap there is even bigger than anything we've covered so far. Subscribe if you want to see exactly how big.